Okay, just found out this afternoon that the nursing home that my dad is in is ending their Medicaid contracts. And he has until September 15th to figure out what to do. And so I've just been down the rabbit hole to try to figure out why would a nursing home end their Medicaid contracts.
So it's because of the big beautiful bill. I'm going to save you the trouble of going through a deep dive. That's why.
My dad lives in a nursing home, and by now I'm sure you've seen the video circulating about the woman who's really concerned because her dad is getting kicked out of his nursing home due to Medicare. And this is just the anticipatory changes that the big beautiful bill is putting into place. What people don't understand is a lot of nursing homes are actually owned by these big corporations, right? So the big corporations, your local branch isn't that, but like they are owned like by private equity, things like that. Like I know the one that my dad lives in is like that. And so the rules kind of come from on top. So it sounds like some of these nursing homes are figuring, well, we're not going to get reimbursed from Medicare in the future. So we're going to just start evicting people who, pay that way because we don't want to suffer the losses. And instead we'll try to fill those spots with people who pay out of pocket.
Breaking news this afternoon. So if you have a mom, a dad, a grandma, an uncle, a brother, a sister that lives in an assisted living facility, a nursing home, be prepared to make some room on your couch, room in your spare bedroom, because most likely you will have a family member that will have to move in with you soon enough. Let me explain. So 99% of nursing home facilities, assisted living for the elderly are no longer going to be accepting Medicaid.
Family, imagine working your whole life, paying taxes, contributing to the society, only to end up in a nursing home where you might be evicted in your 70s, 80s, or 90s just because Medicare and Medicaid funding are being slashed. That's the heartbreaking reality playing out in America right now. And yes, a lot of white folks are crying online as they realize this system doesn't care about them either. Family, many white people voted for Trump because they knew that the system would be working for them. But right now we are seeing Medicaid and Medicare being cut. They're being slashed. And a lot of people who are in these homes, the nursing homes, are right now being evicted. They've been given a 30 days notice, and most of them should have left the nursing homes latest September. You understand the costs, of that you must pay in a nursing home. They are very, very expensive. The cheapest should be at least $4,000, dollars per month, which is not an easy amount for an ordinary American. So family, right now there is a lot of pressure. The pressure is about the Medicare cuts, the Medicaid cuts, and most of these patients will be kicked out, of the nursing homes. So family, I want us to dive deep into the video. As you'll see, white people crying and asking the government of America why they have chosen to do that to Americans. Family, once the video is done, we will get back and do a critical analysis about the same. Let's watch this video together, family.
My dad lives in a nursing home, and by now I'm sure you've seen the video circulating about the woman who's really concerned because her dad is getting kicked out of his nursing home due to Medicare. And this is just the anticipatory changes that the big beautiful bill is putting into place. What people don't understand is a lot of nursing homes are actually owned by these big corporations, right? So the big corporations, your local branch isn't that, but like they are owned like by private equity, things like that. Like I know the one that my dad lives in is like that. And so the rules kind of come from on top. So it sounds like some of these nursing homes are figuring, well, we're not going to get reimbursed from Medicare in the future. So we're going to just start evicting people who, pay that way because we don't want to suffer the losses. And instead we'll try to fill those spots with people who pay out of pocket. Now, in my case, like my dad, we actually pay out of pocket, or I should say he pays out of pocket for his nursing home care. But what is it going to do when I guarantee you like 70, 80% of the people who are at my dad's facility are in some type of Medicare reimbursement, especially if they're in like very long-term care situations. Like that is super common. I don't think people understand that. And so what's going to happen when these facilities can't fill the apartments because there's not enough people who can afford? I mean, to give you an idea, it's over $4,000 a month, guys. $4,000. I mean, think about like that. That's like almost triple my mortgage. Okay. It's crazy. And in my case, like, what would happen if I was in this situation? Because I'm thinking about that. Like, what's going to happen if, like, my dad's facility, for example, shuts? Because there's not going to be beds anywhere for these people to go. So the burden is going to be on the families. And, like, in my case, I don't have anywhere to put this man. And I don't live in a handicap accessible home. And there is no housing in my area. So I can't just, like, pick up and move. And I have a mortgage from 2011. Like, I can't just move. Like, that's not really an option. So like, I don't know what I would be doing if I was in that same situation, and I am really worried. And if you're thinking, well, I'm so lucky, I don't have anyone in nursing care, I'm not going to be impacted. Let me just tell you that this is just the one little arm of the ripple effect that this is all going to have, right? What's going to happen when hospitals aren't getting reimbursed for things? What's going to happen when your doctors are not getting reimbursed? They're going to go private practice. I'm telling you, this whole healthcare system is like on a house of cards. Like, it's all going to come crumbling down, and it's going to come crumbling down fast, unfortunately. So if you are worried about this, if you have loved ones that are going to be impacted, or you know you're going to be directly impacted by this, please know you're not in this alone. Please give me a follow, give me a comment, because I want to engage with people that are going through this same thing, because it is not easy and we need to come up with strategies together. And sometimes it's nice to just have somebody to vent to. So anyway, I'm here for you guys.
Do you know what's going to be the ultimate result of you being an ableist piece of shit, going on the internet and saying, I'm okay with these Medicaid cuts because I'm an able-bodied person and we just need to quit expecting the government to give us handouts, listening to the Trump administration saying that this is just about waste, fraud, and abuse, and refusing to read the goddamn bill? The result of that is going to be that you one day are going to be sitting there with your thumb up your ass when your mama in the nursing home loses her Medicaid coverage and can't afford to stay in the home anymore. You're going to be sitting around going, what's happening, when they take away your kids' SNAP benefits and you have to send them to school hungry. We are all one traumatic injury away from losing our jobs, losing our health care, and being unable to afford groceries. Your child is one traumatic brain injury away from needing special services at school that require Medicaid coverage for the rest of their school life. And y'all are frothing at the mouth so much to watch people drop dead because they can't afford to take care of themselves or feed themselves that you're willing to overlook all the other shit in this bill. Your dear, darling, genius child you've wanted to be a doctor their entire life won't be able to afford medical school anymore because the government doesn't think that they have to help with those. In fact, your child, who probably is going to need Pell Grants and assistance of some kind, won't be able to afford college at all, much less medical school. Y'all, I had to record this in my car because I was so goddamn mad. I didn't want to disturb the neighbors. So frustrated right now because everyone is just wanting to see other people suffer. Where is y'all's humanity? Where's the humanity? We've lost it all. We're just willing to let people starve, including children.
I live in a super rural area in Illinois, and recently our local newspapers have started posting about hospital closures and how Medicaid and Medicare funds our hospitals and our nursing homes, and how there's a lot of fear surrounding Medicaid and Medicare cuts and possible job loss, possible department closures, things. And there are like about 100 MAGA in each post, and they're just like, show me the data, I want to see the numbers, show me the financials, like they'll understand it. It's just so comical to me. They are telling you, we have already closed our OB department, we have already closed this clinic and that clinic. People are already driving an hour to an hour and a half for healthcare, especially women's healthcare or mental health. People are still in disbelief, like the newspapers, oh, you're just a liberal newspaper, look at you've gone woke. It's not woke in a bad way to understand how these cuts and these policies impact us, especially in rural areas. Like, you have to wake up and face reality at some point that you voted for this, and now you're going to be impacted. Your neighbors, your friends, your family, we're all going to be affected by this. It's your fault. You have to open your eyes and realize that. You can't just live in denial. They're telling you they're going to close. When they close, are you still going to be in denial? No, you're going to blame it on Democrats somehow.
What happens when Medicaid goes away or gets cut? So In Lehigh County, we have a nursing home that's primarily funded by Medicaid. I'm the controller of Lehigh County. Last year, I signed checks for about $90 million in order to keep our nursing home open. Our nursing home has about 670 beds, so 670 people. So if there was a 10% cut, which is currently what's being suggested, or an 11% cut is actually what they're suggesting, that would mean that 67 people would be displaced out of our nursing home. Or alternatively, there would be a cut across the board, meaning that we would get paid less for every single bed, and that would make it unprofitable. So we would have to, potentially close the entire nursing home, increase taxes, or go back to the families to get them to fund the rest. So I think the important thing to keep into consideration going forward is, so while they may be trying to find efficiencies at the federal level, when that comes down to the local level, there will be an impact. In this case, one of the impacts would be our nursing home, which will be underfunded. And so eventually we will either need to shut the nursing home, reduce the number of people in the nursing home, or the public is going to have to pay those increased costs. And, we're talking in the order of, $10 million or something along that line. That would either be shared amongst the entire community, or it would go back to individual families, but the likelihood of the individual families being able to pay for it is seemingly unlikely. In any case, I'm just trying to inform you as to what might happen locally if Medicaid gets cut. I also want to make sure we're clear on what Medicaid is versus what Medicare is. So Medicare with the E on the end, you can kind of think of that as E for elderly. So that means, they're past 65 years old. Sorry that you're elderly at that point. But nevertheless, you're past 65 years old and you're sort of entitled to some benefits at that point. Medicaid, with a D on the end, is for the disadvantaged. So these are people that have typically no money or an inability to pay for their nursing home themselves. So Medicaid is for the disadvantaged, Medicare is for the elderly. Medicaid is what we're talking about, the cuts for Medicaid for the disadvantaged. Thank you.
So I work in long-term care. I am the assistant director of nursing at a behavioral health facility, and I would say that about 98% of our residents are Medicaid or Medicare recipients. So of course I have been thinking nonstop about all of the cuts that have been made, because not only will I be impacted, but I also have, over 100 residents to think about, and it is absolutely devastating. But someone had mentioned today that there was an article that had us listed as one of the facilities that would be on the chopping block if these cuts do the damage that they anticipate that they will do. It is estimated that there are about 57,000 people currently living in nursing homes in my state. Where are those people supposed to go? Many of them came in from the streets. Those that didn't, they don't have anywhere to go. They don't have family to live with, or they'd be there now. There are approximately 703 certified nursing facilities in my state, and 579 of them are on this list of being at risk to close due to these cuts. 57,000 people at risk in one state. And that doesn't even count the people that are living at home, should be in a nursing home, will have no opportunity to go to one. That doesn't even count all the people that have been denied and that are sitting in hospitals waiting. That doesn't count all the people that have private insurance or could be private pay, but there's not going to be any facilities to house them. What are we going to do for our elderly and disabled? This stuff keeps me up at night.
But you thought when you voted for Trump, you thought it was not going to impact you. So I woke up seeing a lot of people complaining that now nursing homes are ruling out Medicaid patients. And to that, all that I'm going to say is we told you so. And you thought that Medicaid costs were not going to impact you. You thought that only immigrants were going to be impacted. So guess what? Now you will have to go and grab your mom and pops, get your basements ready to put them there and provide care around the clock. Because some of these elderly people, they need to be readjusted if they're bed bound. They need to be showered pretty frequently. They need exercises. They need to be fed around the clock. But we told you so. And I don't want to hear anyone saying that voted for Trump saying, oh, we didn't thought he was going to do this. No. We're talking about a federal felon, okay? He is a felon on multiple charges in the federal court, and you still voted for him. We told you so. Good. It's good that it's happening, because we told you so.
I don't know about you all, but I have gotten dozens of videos on my For You page of people talking about how their parents and their grandparents who are currently in long-term care facilities and are currently on Medicaid are getting these notices that they will be evicted from their facilities and they need to either pay up or find a place to live. And they're confused about why that is. And as a health economist who studies healthcare financing, I have a little bit of insight as to what's going on. And a lot of it boils down to the One Big Beautiful Bill Act, which was passed in July, made these significant cuts to Medicaid. In fact, over $911 billion in cuts to Medicaid over the next 10 years. As I've said in numerous videos about Medicaid, Medicaid is a state-by-state run program. So each state is having to make decisions about what they're going to cut because the federal government has in turn cut their budgets about who they're able to cover and what they're able to provide in this Medicaid system. And for those of you that don't know, Medicaid is a huge provider of coverage for individuals in long-term care. In fact, 2/3 of residents of long-term care facilities are covered by Medicaid, and that's because of the financial differences of what Medicare versus Medicaid can cover, which I'm happy to get into in another video. In addition, this bill prohibits states from instilling new provider taxes, which would allow states themselves to raise money to support their Medicaid populations in light of the lack and the lessened support they are receiving from the federal government because of this bill. And so with these significant cuts to Medicaid, there's a lot of financial instability of these facilities, which largely accept Medicaid patients, to make decisions about how they are going to financially survive as an entity. In fact, a Senate finance report done recently in a cooperation with the Brown School of Public Health found that 573 facilities, long-term care facilities, were at the most risk of closing. And the biggest determinant of whether or not these facilities would close, in addition to occupancy rates and quality star ratings, is the percentage of residents who are currently covered under Medicaid. If you are a facility that covers a high proportion of Medicaid patients, your facility under the One Big Beautiful Bill Act is at the most risk of closing. So thinking about this from a business perspective, if you do not want your facility to close, you are going to have to make difficult decisions about what percentage of your folks are covered by Medicaid versus what percentage of your folks are paying out of pocket for long-term care. I would also be remiss if I didn't also mention that long-term care facilities, nursing homes, have been bought up in recent years by private equity, upwards of around 5 to 15%, depending on the studies that you read. I'm happy to talk about the effects of private equity in long-term care, but I think you can kind of get what I'm putting down, you know what I'm saying. So I hope that answered your question. Happy to talk about this stuff all day long, but as always, if you have any questions, let me know.
This bill significantly affects nursing homes in a negative way. Currently, these facilities run essentially like a deficit because Medicaid just doesn't pay enough to have it stay open. So they pull from federal funds, state funds, and they have other special fees that kind of make up all the differences to make sure these stay open. Part of this bill is essentially outlawing the ability to have these extra funds to ensure that they stay open. So it's just going to be not viable for many of these facilities to continue to be open. On top of that, the bill has outlawed the staffing ratio that said that there needs to be a registered nurse on duty 24 hours a day, 7 days a week. There's supposed to be a nurse for 30 minutes of safe staffing per patient, and then CNAs 2.5 hours, and now that's outlawed. So unsafe staffing ratios are going to be wild.
So you were telling me that people are unaware, they're unaware that the whole reason why hospitals are not allowed to turn you away in an emergency situation, regardless of your ability to pay, is because of the Emergency Medical Treatment and Labor Act, which states that hospitals who receive Medicare funding are not allowed to turn you away. And they are proposing to cut back on Medicare and Medicaid Talk to a caseworker. There are no ineligible people who are receiving it. The only people who are receiving it are eligible because there is a vetting process. All these people that they say are illegally getting it, it's not happening. The point is to start the process to get rid of it entirely. And if we get rid of the only guaranteed payment for medical care in this country and we leave it all to our pockets with no support, guess what's going to happen to you? You are going to lose out on care because hospitals are going to close who depend on that funding. We don't have enough money to pay the bills that they decided were fair, which I'm sorry, I just had a life-saving surgery and I owe $3,000. If I don't pay $55 fucking dollars that I don't have to my primary care physician, they can decide to no longer treat me, and they will. And I've got to start all over again somewhere else. You all think that you're safe because, it's been that way because we fought to get it that way, and they're reversing it. You all have been so fucking pampered that you don't understand what we had to fight for to get you. Oh, but everyone dies. Bitch, apparently not fucking politicians.
Yep. Them nursing homes finna not take Medicaid, so y'all better get them rooms ready for Meemaw and Pawpaw. Yeah, combine them kids' room. Get rid of the den, man cave, whatever y'all got, scoot it over, because Meemaw and Pawpaw is coming to the crib. I don't want to hear nothing. This is not what I voted for. Yes, this is absolutely what you voted for. Okay? No, I don't want to hear any of that. Meemaw and Pawpaw will be at the crib in 30 to 45 days. All right? Yeah. Yeah. That's where we are. And listen, before you get in my comments with that red, blue, left, right, I don't want to hear none of that, bro. You can put that Trump hat and that shirt on your Meemaw and Pawpaw, but they coming to the crib. You can best believe that. If your in-laws use Medicaid, a lot of these services are going to not accept Medicaid. So yeah, make room.
Breaking news this afternoon. So if you have a mom, a dad, a grandma, an uncle, a brother, a sister that lives in an assisted living facility, a nursing home, be prepared to make some room on your couch, room in your spare bedroom, because most likely you will have a family member that will have to move in with you soon enough. Let me explain. So 99% of nursing home facilities, assisted living for the elderly are no longer going to be accepting Medicaid. Yes, guys, you heard me correctly. Nursing homes and assisted living facilities are no longer going to be accepting Medicaid, which means that the majority of the elderly people in those facilities are going to be without somewhere to go in about 30 to 45 days. And that is all thanks to the big, beautiful fucking bill that everybody thought was so great. So prepare, guys, if you have family members of, that are elderly and that are currently in nursing homes, assisted living, make sure you scoot over some room on your couch in your spare bedroom, because you will have family coming over. And that is all thanks to the fucking Trumpies, Latinos for Trump, all the stupid lawmakers, and everybody else that did not want to listen and thought the big, beautiful bill was going to be big and beautiful, is turning out to be a complete shit show. And it's fucking hurting the most vulnerable people in the world today, the elderly. Fucking disgusting. Let me know in the comments what you guys think. Share this video so everybody knows what's going on and what's going to happen in 30 to 45 days. Be safe out there, my loves. I love you.
Family, this is yet another FAFO moment. Another moment where MAGA supporters are regretting voting for Donald J. Trump as the President of the United States of America. Family, we are seeing cuts in the Medicaid, and many nursing homes, are risking closure because most of their patients actually depend on the Medicaid, because most of these elderly people are not able to pay, for these sessions from their pockets. They depend on cover, now that the government is slashing Medicaid, that, is what is happening right now in America. The nursing homes are risking closure because most of their clients, depend on this cover. And family, this is another powerful moment. People are regretting so much for having voted Donald J. Trump. It is very, very sad that parents, elderly people will lose their lives because they cannot be able to get the best care from their homes. So family, I went further to do my research, and here's what I found out. The Medicare covers are usually short-term rehab, limited nursing care, but long-term stays usually fall under the Medicaid. And when the Medicaid funding gets cut, nursing homes lose money. What do? They push the residents out. What is happening right now in America? Families either have to pay out of pocket, we are talking about $8,000 to $10,000 per month, or scramble to find another facility. Family, imagine paying from your pocket each and every month between $8,000 to $10,000 without fail every month because the government has slashed Medicaid. Family, it's crazy right now in America. And some of the people who thought that this won't affect them were the white folks. They voted for Trump because they knew that the interests of the white people would be met. But whatever is happening right now in America is opposite from what they actually had anticipated. So when we look at this, who's affected right now? This isn't just poor people or people of color anymore. The middle class and even working class, white families are realizing that the safety net they thought would protect them is full of holes. And the TS online proves it. People are finally seeing how brutal the system is. People thought that this is anything that the MAGA is doing, anything that President Trump is doing was going to affect the black people, the black and brown communities, and the marginalized community. But for the first time, they are now starting to see that this thing is affecting each and every citizen of the United States of America. Everyone is going through, this heaviness together. The Medicaid cuts is affecting everyone. The slash is affecting everyone. Imagine paying $8,000 to $10,000 per month in Medicaid. It's crazy because there is no Medicaid cover. You have to pay that to ensure that your grandmother or your mother, your father or grandfather gets care from the hospital. And there's one thing that we cannot lie to each other. Having the care at home is very, very difficult. And most of the time, the elderly will be affected, You know what's wild? America has money for endless wars, billions of corporations, tax breaks for billionaires, but somehow can't find enough to keep grandma and grandpa from being kicked out of a nursing home. The math is simple. Profits over people. The funny thing is that the rich, the billionaires, are getting tax breaks. America has money for wars, but where they draw the line is where the elderly need them. With the Medicaid, they cannot be able to spare money for that same function. What's the fate of old people right now in America? Things are going to worsen, as days goes by. And here's the kicker. Many of these same families never thought they'd be on the chopping block. But this is what happens when a broken system goes unchecked. It comes for everybody. It does not matter if you're a MAGA voter. The system is now slashing everybody. Everyone is being affected with whatever is happening right now in America. Everyone who has a parent, who has a grandfather or grandma in a nursing home right now has to go deeper into their pockets to ensure that they can be able to leave their parents, in the same nursing homes. The funny thing is that the very nursing homes are risking closure. Imagine if everyone took their parents and their grandparents back home. What happens next? The nurses will also not get any works to do. The nursing home will eventually close, and this shall have affected another sector. The situation is a warning sign. Healthcare in America isn't really a safety net. It's a business model. The elderly, the disabled, and the vulnerable, they become costs instead of people. And when cut happens, the weakest get tossed aside. So when you see white folks crying right now online about their parents and grandparents being evicted from the nursing homes, understand this isn't just their fight. This is the reality millions of Americans, black and white, face when a system values profit more than human dignity. If we do not demand for change, this problem only gets worse. Family, it saddens me so much when I see this happen in America. And this is as a result of people who put their own self-interest ahead of others. They do not care. Billionaires are still getting tax cuts, while they cannot be able to fund, the government cannot be able to fund Medicaid. They're slashing Medicaid. They want people to go deeper into their pockets to be able to pay for healthcare services. What saddens me most is this is affecting the elderly in America. And this is as a result of people who thought that if Donald Trump was the president of the United States of America, whatever they want, they'd get. Another far moment. Everyone right now is struggling with paying, because after September, who knows? You could be paying up to $10,000 per month, for a nursing home. And that is a crazy amount of money. For somebody to maintain their grandparents for a whole year, imagine how much they must go deep into their pockets to spend. It's actually very crazy. Family, what do you think? Should nursing homes even be allowed to evict residents because of funding cuts? And do you believe America will ever put people over profit when it comes to healthcare? Drop your thoughts below, and don't forget to like, share, and subscribe to the channel. Family, I always tell people to like the channel because when you like our videos, they get recommended to other people to also watch my channel. Family, I'd also request that you comment on the comment box down below. Let me know what you think about the slashing in the Medicare, and elderly people risk, going back at home because they cannot be able to afford the nursing homes. Family, subscribe to the channel. We are currently on the road to 50,000 subscribers, and guys, I'd really appreciate if you all do consider subscribing to the channel. Thank you, and see you all in our next episode. Goodbye for now.